everyone. My name is Pharmacist Michael, and I'm here to help you live a happy, healthy life. Today, we're going to talk about a frustrating and often misunderstood condition. This is a condition that I actually have and have had for several years. This is tinnitus, that persistent ringing, buzzing, or whooshing sound that just won't go away. Whether you're experiencing it yourself or know someone who is, we'll cover the causes, treatments, and coping strategies, plus some fascinating insights into how serotonin and dementia play a role. And stick around to learn how AirPods might actually help. I want to remind you that if you're interested in improving your life, please check out pharmacistmichael.com to learn the supplements and products that I use. First, what is tinnitus? Well, tinnitus is the perception of sound in your ears or head without any external source. It can sound like ringing, buzzing, hissing, or even clicking. For some, it's a mild annoyance, but for others, it's debilitating. Tinnitus isn't a disease itself, it's a symptom, often linked to other underlying conditions. Let's talk about causes. Tinnitus can be triggered by several things like hearing loss. Age-related noise-induced damage to the hair cells in your inner ear is the most common cause. Ear infections or blockages. Wax buildup, infections, or fluid in the ear can cause temporary tinnitus. Drugs like aspirin, certain antibiotics, or high doses of NSAIDs can be ototoxic, meaning they damage the ear. Stress and anxiety can amplify tinnitus symptoms. Health conditions such as high blood pressure, Meniere's disease, or even jaw issues like TMJ can contribute. Here's where it gets really interesting. Serotonin, a key neurotransmitter in your brain, plays a significant role in tinnitus. Changes in serotonin levels can affect the auditory system, sometimes exacerbating tinnitus symptoms. That's why some people notice their tinnitus worsens with stress, anxiety, or certain medications that alter serotonin levels. This connection also explains why tinnitus is linked to conditions like depression and anxiety. It's a two-way street. Tinnitus can increase mental health struggles, and mental health struggles can worsen tinnitus. I want to share a personal experience here. I recently tapered off duloxetine, which I had been using to help manage the pain caused by degenerative arthritis in my back. Even though I tapered the medication relatively quickly, the most noticeable side effect from discontinuation syndrome has been a huge increase in my tinnitus symptoms. This spike in tinnitus has been so severe that it has disrupted my sleep, making it difficult to find relief. It's a vivid example of how changes in serotonin and the medications that influence it can directly impact our auditory symptoms. If you've experienced something similar, know that you're not alone. It's crucial to be aware of these connections and work closely with your healthcare provider when making changes to medications that affect serotonin levels. Managing stress, improving sleep, and seeking support can all help when dealing with tinnitus, especially during periods of adjustment. Did you know tinnitus might also have implications for cognitive health? Recent studies suggest that chronic tinnitus is associated with an increased risk of dementia. The theory is that the constant noise in your ears puts extra strain on the brain, diverting resources away from memory and thinking processes. While the exact link isn't fully understood, managing tinnitus could potentially reduce this cognitive burden. Now let's talk about treatments. While there's no universal cure for tinnitus, there are plenty of ways to manage it and improve your quality of life. First, sound therapy. White noise machines or apps can be a game changer for many people. They help mask the ringing, especially in quiet environments, and make it easier to relax or fall asleep. Second, hearing aids. For those with hearing loss, Hearing aids not only improve hearing, but can also reduce tinnitus perception by amplifying external sounds and making the internal noise less noticeable. Next, we have cognitive behavioral therapy or CBT. This therapy doesn't eliminate tinnitus, but it helps you change how you respond to it, reducing the distress it causes. Sometimes, medications like antidepressants or anti anxiety drugs can be helpful, especially if tinnitus is affecting your mental health. And finally, never forget diet and lifestyle. Reducing caffeine, alcohol, and stress can often improve symptoms. Adding relaxation techniques like yoga or meditation can also be beneficial. And don't overlook hydration and eating a balanced diet rich in antioxidants. Your ears will thank you. Remember, managing tinnitus is all about finding what works best for you. With the right combination of treatments, you can regain control and minimize its impact on your life. Here's a surprising tip. AirPods and similar devices might actually help some people manage their tinnitus. Let me explain how. First, the noise canceling feature. This can block out external distractions, creating a quieter environment for focusing on soothing sounds or sound therapy. It's especially helpful in noisy places where external sounds might worsen your perception of the ringing. Second, sound therapy through streaming apps. There are apps specifically designed for tinnitus relief that you can use with AirPods. These apps provide calming sounds like rain, ocean waves, or white noise. And some even offer personalized therapy that adjusts to your unique tinnitus profile. These apps can be a fantastic tool, helping to mask the ringing and giving your brain something else to focus on. They're great for relaxation, meditation, or even helping you fall asleep. And it doesn't stop there. Some apps combine sound therapy with guided meditations or breathing exercises, which can reduce stress, a key trigger for tinnitus symptoms. AirPods can also help during daily activities like walking or working by providing a subtle background sound to keep the tinnitus less noticeable. So, if you've got a pair of AirPods or similar earbuds, they might just become a handy part of your tinnitus management toolkit. And the best part? You're using a device you probably already have. And if you don't, I put a link in the description section of this video. Living with tinnitus can be challenging, but the right coping strategies can make a world of difference. Let's dive into some practical steps you might take to regain control. First up, stay active. Regular exercise not only improves blood circulation, which might benefit your ears, but also reduces stress, a common trigger for tinnitus. It doesn't have to be intense. Even a brisk walk or yoga can help. Next, let's talk about relaxation techniques. Mindfulness, meditation, and deep breathing exercises are powerful tools to help you stay calm and centered. These practices can reduce the anxiety and frustration that often come with tinnitus. Try this. Inhale deeply for 4 seconds, hold your breath for another 4, and then exhale slowly for 6. Repeat this a few times, and you'll notice a calming effect almost immediately. Connecting with others can be incredibly empowering. Support groups, whether in person or online, allow you to share experiences, learn new tips, and realize you're not alone in this journey. Now let's focus on sleep hygiene. Poor sleep can make tinnitus feel louder and harder to handle. A good night's sleep can do wonders for your overall well-being. Set the stage for restful sleep. Keep your bedroom dark and quiet. Avoid screens before bed. And consider using a white noise machine or fan to mask the ringing. And finally, don't forget the importance of engaging in hobbies. Activities you enjoy can shift your focus away from tinnitus and provide a much-needed mental break. Whether it's gardening, painting, or even listening to calming music, find what brings you joy. Remember, while tinnitus may not have a cure, these strategies can help you take control and improve your quality of life. You got this. Tinnitus can feel overwhelming, but you don't have to suffer in silence. Understanding the causes and finding the right strategies can make a world of difference. If you found this video helpful, don't forget to like, subscribe, and share it with someone who might benefit. And as always, stay happy and healthy. And don't forget to visit my website at pharmacistmichael.com to get your hands on products that can help you be a happy, healthy person. I'll see you in the next video.